Hey, welcome everyone. Welcome to Wellness Wednesdays with Mindful Nurses. My name is Janelle and I'm co-hosting this event with Claudia Wong. We share these events every Wednesday to support nurses' mental health and well-being through holistic wellness and self-care practices to reduce stress, restore calm, and prevent burnout among nurses. And we're really happy today to have Tina Hodgson with us, and she will be sharing an emotional freedom technique, EFT, also known as tapping practice, with us. We're so excited to have Tina with us today. This is so important for us as nurses. A lot of nurses are experiencing trauma at work. I was just looking at a study before this session that was saying something like 85% of frontline nurses have experienced some kind of traumatic event on the job, and only half have had any kind of pre-exposure training related to trauma, and only a third are accessing professional help for this. So we really feel that this is very needed for nurses, and it's so important for nurses to have these resources and tools to self-care, to address trauma that we're experiencing on the job, and to regulate our emotions for our own personal healing, both for ourselves and for our patients. So we're really happy to have Tina sharing this practice with us today. Tina is a nurse herself, a former emergency room nurse, and worked for many years in emergency rooms across the US before branching out into the holistic wellness space and becoming an EFT practitioner, where she now works with clients online. And I will let Tina introduce herself before we get started. So it's so good to have you here, Tina. Thank you for coming.
Hi, thank you for having me. I really appreciate this opportunity to talk about this today. I think it is a really important conversation, just as you said. And I am so passionate about EFT, so I'm really excited to share it with the nurses. Yeah.
Thank you so much for being here. We're really happy to have you. So yeah, we can just dive right in. If you can just start by telling us, what is EFT?
Yeah, and as you said, it does stand for Emotional Freedom Techniques, and it's part of what's been referred to as the fourth wave of psychology therapy. Hedda Stapleton has referred to it as that. And fourth wave includes somatic practices. So they're investigating yoga in that, EMDR, anything that's also involving the body. So EFT is a true mind-body approach. It combines acupressure with elements of psychotherapy, including exposure therapy and cognitive behavioral therapy. And that's kind of like the basic part of what EFT is. It can be really super simple. It looks simple. It looks a little bit ridiculous. And it's effective and really layered and powerful. Yeah.
Awesome. And in what situations do you use EFT? What would you recommend it for?
And actually, before I say that, I should also say that it's often referred to as tapping. I think a lot of people may hear it as tapping rather than EFT or emotional freedom techniques. And it's called tapping because literally in the practice of it, it's part of the procedure to be tapping on the acupressure points. What it can be used for, there's a wide range it can be used for, trauma, PTSD. It's been studied and shown to be effective for depression, anxiety, phobias, food cravings. You can use it when someone cuts you off when you're driving and you get upset about it. It really can be used. They're using it, I think you maybe had mentioned in the introduction, in schools with children, test anxiety. Yeah, anything that is stressful, EFT can be used for that. And so many of our chronic pain, chronic illnesses also will respond with EFT as well, because again, an underlying cause of those can be stress as well.
Amazing. Yeah, again, so important for nurses. As most nurses, we all experience some kind of stress, and a lot of us even some kind of trauma. So sounds really relevant. Yeah. Can you just tell us a little bit more about the science and the background of how it's actually working, like on a scientific level, and what results are being seen with it in terms of what the science says.
Mm-hmm. Well, if you consider how, our nervous system and our brain is constantly scanning the environment, it does that on a subconscious level. We're not even aware of it. So sometimes, so a lot of times, if something stressful happens, our hippocampus is recording basically all the time and creating memories. And if a memory or an experience is happening that is stressful, that is life-threatening, it's going to engage the amygdala, and it's going to start to tag things for us to keep aware of for the future, so that if that happens again, then we can react quickly. So if you consider that, when we're tapping, Harvard Medical School has actually done 10 years of research on acupuncture and has shown that when you are stimulating the meridian points, and in EFT there's several in the face, upper torso, and hands. So when you're stimulating those, it's been shown to actually send calming signals to the amygdala. So something stressful is happening, but you're sending calming signals, and that creates a sort of dissonance in our body and our brain, because you can't hold a healing, calming signal at the same time as something that's stressful. It just can't. So one of the things has to go. And they've found that having both of those signals at the same time will prompt the body to have new learning. And there's research with memory reconsolidation, and they actually have found 3 criteria for the body to make new neural pathways. And one of those is having a vivid recall of what had happened before, or a vivid recall of a past learning, a past experience, something stressful. And in EFT, we do that. It's a mindful practice, in that we want to bring to mind what is bothering us. We actually speak about the problems. And then the second part is having a juxtaposition experience. That's what they call it. And that's actually having in mind the old learning, or what you already know, with a new idea. And in EFT, we actually use what we call as a setup statement. And it's, even though I have this problem, I choose to love and accept myself. And it can be any combination of positive affirmation, but you really need the negative and the positive with it. And then with the third criteria for the memory reconsolidation is for that to be repeated several times. And again, that's also part of the EFT protocol, in that you're going to be repeating these statements and be repeating what is stressful while you're tapping on the points. So it's really, as I said, it's really layered. It's simple, and people feel so ridiculous saying it, like, okay, even though I'm angry, I love and accept myself. It feels funny to say it, but it actually scientifically is having a profound effect on your brain.
Yeah, that's really beautiful, because it really is a perfect example of this mind-body connection, that you're fusing practices that are both working with the body on these acupressure points, and also working with the mind through this NLP of neurolinguistic programming, of changing our thought patterns, using affirmations to change what our mind is thinking, while at the same time calming the body. So it's a really powerful 1-2 punch of this mind-body connection merging. That's really beautiful.
Yeah. And it's funny that you say NLP as well, because I really feel like, personally, I don't really have a lot of knowledge on NLP, but the creator, Gary Craig, he was an NLP master. So many of the elements are actually built in when you look into it. And yeah, so it's just so interesting that I guess I use elements of NLP without even knowing that I'm doing it.
Yeah, I'm not very familiar with it either. I've just heard about it, but yeah, regardless, just using some kind of affirmations is really beautiful.
And even I think some of the elements of NLP that are built into that too is really what makes EFT most effective is when you're as specific as possible. And again, you consider how we're engaging the amygdala and the hippocampus, and wanting to get into directly into the neurosynapses of what that memory was, what that belief is, what that feeling is. Then that part of NLP as well is, using your brain as a computer, basically, and uploading the file, rearrange it.
Yeah, rewiring our brains. Awesome. And we talked a little bit about why it's important for nurses already, but I don't know if you have maybe a little bit more to share from your personal experience as a nurse, or
Mhm.
even before becoming a nurse. How do you find EFT relevant for nurses or
Yeah.
in your personal life? What brought you into EFT
Mhm.
to begin with?
Mhm. Great question. Yeah, I feel like there was my life before EFT and there's my life after EFT, and they're drastically different. I came to EFT at a time where I was just ready to heal. I had experienced what I didn't actually realize was what I was experiencing was complex PTSD. I had experienced some childhood trauma, some childhood sexual abuse as well. And even though I had been in therapy from age 5 until even on and off in my 30s, no one, and you know, talking about these experiences that I had, no therapist had ever said you experienced trauma. They never used that word, or childhood emotional neglect was never used. And it was never discussed that maybe the symptoms I was having, like hypervigilance and food addiction and disassociation, there's a whole list of things that I really now know. Now I have a name for it. Before it was just treated as bad habits. So at the summer that I discovered EFT, I was just ready. I was ready to heal, and I was just looking for something. And I went to Burning Man of all places, and that's where I discovered EFT. So even though there's this sound research that shows that it's effective, from my personal experiences with it was that I felt it in my body, how it was really helping me, really getting into like the core of what was happening. Yeah.
Mm. Yeah, I really appreciate your experience, and I feel it really resonates for me. And I think so
Mm-hmm.
common in our culture and our society to not recognize, not be trauma informed, not be trauma aware. Um, as former trauma ER, emergency room and trauma nurses ourselves, I always thought of trauma as just like life-threatening kind of trauma. I didn't think of it as childhood emotional neglect and those kinds of things. So it seems that there's a growing awareness in our culture and our society of how these smaller traumas, if you will, or other kinds of trauma can affect our,
Yeah.
our behavior patterns and need attention and need healing.
Yeah. And it is really important to consider. I feel like moving forward, being trauma informed in all areas, even teachers really, because they're with children every day. Teachers, healthcare professionals, therapists especially need to be trauma informed. I was looking at some statistics. There's a study that was done actually looking at health outcomes for adults who had experienced childhood, they called it adverse childhood experiences. So it's the ACEs study.
Mm-hmm.
And one statistic was that at least 46% of children in the US will have experienced at least one adverse childhood event. And that could be, death in the family, divorce, someone going to jail, over abuse. There was a list of them. So yeah, 46% of people will experience at least one of those. And even just one can be traumatic for someone depending on what their resources were, what their resilience is, what's going on.
Mm-hmm.
But 4 or more of those adverse events actually do lead to medical problems, asthma, diabetes, cancer. Yeah, there was a lot that was connected with what happens when you're a child.
Yeah.
And then
Yes.
on top of yeah, go ahead.
Go ahead. Yeah.
And then on top of that, there was, I believe, a stat from the National Council that I saw that, again, in the US, at least 70% of adults will have experienced at least one traumatic event in their life. So this is not, my case isn't special.
Yeah, definitely. All of that sounds like something we've all experienced in one way or another in our lives. So how do you feel like emotional freedom technique, EFT or tapping, is a useful resource for addressing this trauma that we all have somehow experienced?
Yeah. Well, and there's a psychiatrist who is also a trauma specialist. And he's been in this field for the last 20 years. And it's Bessel van der Kolk. He wrote the book, The Body Keeps the Score. Yeah. And he says that just cognitive therapies or using your mind is not going to actually take care of trauma because it's encoded in our viscera. That's what he says. And if you think about it, our bodies are really an extension of our subconscious. The tensions that we hold are how our nervous system is acting out in terms of what's our digestion doing, what is our heart rate. All of these things are subconsciously run, right? So our body needs to be engaged. So just to talk about a trauma can actually be re-traumatizing because you're bringing this up, but then there's no safety signals. There's no and, this bad thing and a good thing. Usually it's just talking about it, maybe trying to reframe it. But if the body's not engaged, then you're just going to be kind of going in that loop. So EFT is really effective because of the stimulation, because of the meridian tapping, because of the signals that are sent to the amygdala. And research is backing this up, and it's actually really exciting and what's the word I'm looking for? Hard to believe, actually. It's hard to believe sometimes. In some cases for PTSD, when they are studying it, comparing it to cognitive behavioral therapy, they'll find that they might have the same results, but the sessions needed in EFT can be, so the gold standard for cognitive behavioral therapy is about 12 to 18 sessions for PTSD, whereas it's been found in research that sometimes even one session, maybe the average of 6, but about 1 to 10 sessions is needed for EFT for that PTSD to be cleared. And when rechecked again in 18 months, the remission remains. They're no longer meeting criteria. So I just think it's going to be like everyone needs to know about this because it's about to be a big thing. It's just so effective.
Yeah, it sounds like the science is really strong for backing why EFT is effective. And I'm curious if you can share what is your personal experience with how EFT has helped you in your life, both personally and as others.
Great question. Personally, my life 4 years ago compared to now, actually 3 years ago, it was 3 years ago that I started using EFT as my own personal practice. It's completely different. I was obese. I was $20,000 in debt despite having, a job in California, which was paying well. I was losing years sometimes to depression and apathy. I just didn't understand. I didn't know. I thought that was just life. Coping with food, coping with drinking and alcohol and partying. It was that's just what my life was. And after I discovered EFT and I was ready for these changes, and just slowly picking away at the threads, dissolving memories, dissolving emotional charge related to memories, becoming more attuned to myself, my feelings, that all changed. I was able to clear my debt, save money to be traveling now in Southeast Asia for over a year and a half without working. I don't lose years to depression. I, just like everyone else, I will have something come up and I might be down for like an hour or 2 hours a week, sometimes depends what it is, but I have this practice that lets me be mindful and lets me actually feel what's there and dissolve it so that I can have clarity about what I want to do to move forward. And it's something that's transportable. Like I can do it with my own hands. I can also reach out for help. There's videos. So it's really this versatile technique. And then on top of that, as I started to get to know myself, to know my reactions, to be more mindful about what I was doing, what patterns I was replaying, I would notice what I would bring into work and narratives that I would have from childhood of not being supported, no one's here to help me. And really see how I was actually perpetuating that. Because I would have coworkers come and ask me if I needed help, and I would act irritable. I would push them away. I would really block that. And there was just, I remember this day of just really noticing that I was doing this, of being irritable, pushing people away. And then I could hear the voices. No one's supporting me. No one's here to help me. And just really seeing that as like a track that was coming up, and was then able to be mindful. Maybe I wasn't able to be really like joyful and engaged with people at that point, because I was in a stressful situation, but I was then able to be aware of that voice, maybe sing a song in my head, tap on my fingers, go to the bathroom, and really just tap about the stress I was having and how I was feeling. I would, on my breaks, I would go outside, sit in nature, again, being more mindful of what did I need to support my nervous system in this time, and I would tap on what was happening. I would also sometimes tap on the way to work, because we're already, your body's already like, oh, I'm going to work. Kind of that, I think, also elements of PTSD where you're expecting to feel a certain way. So I would tap on the way to work, just how I was nervous, what was going to happen today, what I was feeling in my body related to going into work. And I would also start to tap on after work and the things that had happened, and really try to keep on top of clearing the stress of what had happened, because it accumulates. Just, I think of it's emotional hygiene, right? And a lot of us take the time at least to brush our teeth a couple times a day, hopefully wash your hair, do those things, but we don't take the time to clear out our emotions and get our system clear, and keep our system clean, and that builds up, and it has an effect.
Yeah, I think that's so true, and I can really relate to what you're saying, that it's really common for us in society and as nurses to deal with stress by just pushing it down, or dealing with emotions by pushing them down, by numbing them through alcohol, through food, through whatever it is that we use to push those feelings away, and then they build up and cause deeper depression or lack of energy or weight gain or whatever it may be that affects us in our lives. And also, like you were saying, like even at work, like not being aware of how we feel and not knowing how to reach out when we need help, how to reach out for help, how to receive help. So yeah, I think everything you're saying makes a lot of sense to me, and is so important for everyone, and especially nurses, for us to be able to be more aware of our emotions and to reach out for support and process our emotions. So this sounds like a really wonderful, wonderful practice. And I'm curious if you have tips for how EFT could be brought practically into a nurse's life, or even into the workplace, either in the workplace or outside of the workplace for nurses. How can they use EFT?
Yeah. I already mentioned a little bit just in my own practice. I would, take, when I was in the bathroom, I might tap on how I was feeling. So even though this patient's family member is looking at me from the hallway and I'm feeling tense and anxious about it, I love and accept myself, and just processing the feelings in that way. And it doesn't even have to be as what's the word I'm looking for, as formal, I guess, as that. It can really just be, you can be getting equipment and just tapping on like points on your chest. And I'll go through these later to really like let everyone know what the points are. There's some points on your chest. So even when you're grabbing an IV bag or some equipment, just be in there and just like giving your body some signals that it's safe right now. Maybe while you're in there, just like, it is so busy right now. It is so stressed right now. I'm so stressed right now. And just acknowledging it, just allowing yourself to feel it. And then, so then you can, calm your body while you're experiencing that. I think even just, I would then even try to use it with patients as well. I wasn't as solid in what was actually the science of it. And I think I knew it worked because I had the personal experience. I had the felt knowing of what it was doing in my own life. And I still felt like it was a little bit silly, and so I had a hard time bringing it into work, honestly, but I would use it with patients. I had a patient with a needle phobia, and so we tapped a little bit about what her fears were, what she was worried about. patients who came in with car accidents and were like, you could just see their body was shaking. I would have them tap. Some people with anxiety, I would have them just tap in while they were telling me what was happening while I was intaking. So doing a triage, or if they came in by ambulance when I was getting their data, I would just have them, tap on their body while they were telling me. And that also is a part of EFT. It's just called telling the story. That's actually one of the techniques. So it works. Yeah.
Yeah, that sounds
And
like
then,
a really a beautiful, quick tool that we can use anytime, anywhere, just to take a couple minutes out to do a quick decrease anxiety or emotion by just doing a quick cleanse like that. And then also you mentioned before sort of having a lot of traumas built up in the body. Can you also use EFT to address things that have happened in the past that maybe you haven't fully addressed?
Yeah. And there's one study that was done, which I also think is interesting for nurses to consider. Well, there's two studies I want to talk about, I guess, in terms of PTSD. One is that, and this was well before Corona, this was in 2009, but they questioned nurses and asking them about their PTSD symptoms. They basically gave them a questionnaire to see where they were with that. And of the nurses that responded, 22% of them had symptoms of PTSD. So, and again, this was before Corona, like this has already been a problem in our industry. So PTSD, like sleep disturbance, nightmares, depression, hyper alertness, irritability, moodiness, guilt is even a symptom. How many nurses are feeling guilty just trying to like get by and feeling like they're not doing enough even, right? And then of those nurses, there was also 18% of them who actually met criteria for PTSD. So this is that means that 1 in 4 of our colleagues that we're working with right now have PTSD, or just about, maybe a little bit under, but at least have symptoms of that. And so many nurses right now have burnout. And in that same study, 98% of the nurses who met criteria for burnout syndrome did have symptoms of PTSD, or were also met criteria for PTSD. So if you are feeling burnt out, more than likely you are being affected in some way with PTSD.
Yeah.
And we bring, if like me, I already had my own, I guess, mental health problems before starting a nursing career. And so my resilience was really low. And it would be easy to get stressed and overwhelmed. So I was already bringing that story into work. But besides that, we also bring it home. In one study they were looking at that was testing EFT with for treatment for PTSD. They actually had spouses come along with, let me just look at it. There was 218 war veterans that were sent on a 4-day, or sent on a week retreat, and they were sent with their spouses. The spouses didn't receive treatment, but the veterans did. And it was 4 group sessions, and then also 3 individual sessions of EFT. When they first arrived, all of the veterans obviously would have had PTSD. That's why they were sent. After those treatments, 72% of them no longer met criteria for PTSD, and they maintained that 6 weeks after. And that's just with 4 group sessions and 3 individual sessions.
Wow.
But also, of the spouses that went with them, there was something like 29% of them had PTSD symptoms as well, just because they were living with people who had PTSD. So we bring that home, and our loved ones are affected as well. And even with the treatment of just the veterans who were being treated and not the spouses, when they retested the spouses, only 4 of them had PTSD symptoms afterwards as well, without receiving treatment. So how important it is for us to really pay attention to what's going on in our own mental health.
Yes, I really appreciate that you bring that up, and I think it's so valuable to share that, because I think we often can think that self-care is selfish and that caring for ourselves is selfish, But it's so important to recognize that the way we feel affects the people around us, affects our families, affects our patients. And so we really need to care for ourselves so that not only we can be happy and healthy, but everyone around us can be as well. So I really
When you
appreciate
have a regulated nervous system,
Mm,
when you have a regulated nervous system, you can then help other people regulate their nervous system. And
yeah.
think of the patients that are coming in who are dysregulated, who are anxious. And if
Mm,
you're also, your nervous system is also in that dysregulation, you know, that's where I think some work, I know the ER was just, you could feel like palpable, the anxiety that was in the department.
yeah.
Not even just from everyone. So if we can just take these moments of just giving our body what it needs, letting it know that it's safe, taking those sacred moments really, and letting our hearts feel calm, I think it's tremendously important.
Yeah.
Yeah.
Well, I love it. So let's do it. Let's do a practice. Can you show us a practice that we can do as nurses?
Yeah. So with EFT, there's a basic recipe. And what you'll want to do first is just kind of think about what your problem is. The practice that I want to do today, I want to focus on overwhelm and I want to focus on stress. I want people to be kind to themselves. So don't choose, you know, the most, like 10 out of 10 most stressed you've ever been, because, you know, this is this container isn't really for that right now. So something maybe like a 5 out of 10, something that felt overwhelming, but isn't, but you feel safe in focusing on it today. And so with EFT, we focus on what the problem is. A lot of times we kind of can get we think that we need to be focused on the positive. There's positive psychology, you know, you think of manifestation and only think of the good things that you want. But with EFT, you really do need to talk about or be specific about what is bothering you, because that's what we're trying to engage in our brain. So you come up with your problem, which could be, I'm thinking of a workplace thing. When were you stressed? Was it an occasion when you were short-staffed? Maybe you were working with a difficult doctor or team member. Maybe something with family members or patient, just something that was stressful and caused some overwhelm for you. And then when you have that in mind, you want to rate it. And we always rate everything from 0 to 10. So we use SUD scales in EFT all the time. We're always checking our work and seeing how it's going. So 1 is, what is your problem? What do you want to focus on? What do you want to change? The second one, how intense is it feeling for you right now? All right. And then we come up with what we call in EFT a setup statement. And I mentioned that earlier. So even though the problem, I love and accept myself. And so we could, again, take it with the example I used. Even though I have this patient family member that's looking at me from the hallway and I'm feeling tense and anxious, I love and accept myself. And so that's your setup statement. And there's a couple ways to go. The way that I usually do the first part is to find a sore spot on your chest, and it's usually a couple inches down below your clavicle. And there's just going to be this sore spot. And according to the EFT manual, I get, for scientific reasons, there's some like lymph nodes there that we're massaging in to help to get the congestion going, but it's also known as the emotional wells. And it helps for psychological reversal and just to get us engaged in what's happening emotionally for us. And so you just will start to rub those. And while you're doing that, you just repeat the setup statement 3 times. So even though I'm feeling this way, I love and accept myself. And you repeat that. And then the tapping points, there's the side of the hand. And when it's just light percussion. You don't have to be hurting yourself or tapping really hard, just light percussion, maybe 5 to 7 times on each point. Again, it's not mathematical. This is a really forgiving practice as well. So there's the side of the hand. There's also where the eyebrows start to grow, and you can do one side or both sides. We're wired symmetrically, so it's fine. It's personal preference. There's also the side of the eye where there's this bony part, so not so much on the temple, but with this bony part right here. You tap there. There's also the cheekbones. Under the nose. under the lip or the chin point. Yep. And then again on the chest, it's just below the clavicle, but lateral to the sternum. It's kind of where there's like a little dip right under the bone. A little bit more, or sorry, medial. Yeah, right here. You just tap there. And again, it's forgiving, so you can just tap all over if you want to, but focusing more just right up here in the corner is best. There's also the side seam of the body. For women, it's where the bra strap is. In many techniques that are taught, that's kind of the basic points that they use. I also like to do the wrist and hand points. And I think for nurses, it's important because if you're at work, you're not always going to be wanting to touch your face. So it's nice to have this option. So on your wrist, it's kind of the pinky side. There's the bony protrusion right here on the wrist, and you just go ahead and tap that. And then if you have your hand up like this, there's at the base of your nail where the skin and the nail meet, but more on the skin, you just go ahead and tap there. Yeah. So there's that on the thumb, on the index finger. Yep. The middle finger. On the fourth finger, it's actually on the underside. And then the fifth finger, same thing, now on the top again. Yeah. And those are the hand points. And then we just generally come back to the side of the hand again. And then there's the top of the head. And you can focus on the top of the head. There's also points in the back of the head as well. Yeah. Okay, so those are the tapping points. So if everyone can bring to mind what it is that they want to focus on for this session. And go ahead and give it a rating from 0 to 10. This is a practice of call and response. So I will be saying the statements and then you'll be repeating them. Yeah. And then Janelle, did you want to put yourself on, you're on mute now? Yeah, okay. So again, we'll go ahead and find the sore spot. And I'll remind everyone that I will have some general feelings and some thoughts that may be common, but if it doesn't work for you, if it's not quite true for you, please replace it with what does work, because that's best, again, being specific as possible. Yeah. And if it helps to close your eyes, to really tune in to how you're feeling and what sensations are there for you, that's okay too. If it does start to feel overwhelming, just open your eyes and remind yourself that you're safe and that where you are in the present time. Yeah. And go ahead and take a deep breath with a long exhalation out. And then repeat after me. Even though I've been feeling all of this overwhelm and stress, I'm open to loving and accepting myself. Yeah. And on the side of the hand, I'm open to being present with myself in this moment. And acknowledging how I feel, even though I've been so overwhelmed. And on the eyebrows, even though I've been feeling all of this overwhelm, I'm open to the possibility that for right now, I'm safe. All of this overwhelm, all of this stress. And go ahead and take a deep breath. And under the nose, even though I've been feeling all of this overwhelm and stress, relate it to, and then go ahead and describe what has been happening for you. What's been causing the overwhelm? Who is involved? Try to be as specific as possible. And take 30 seconds to do that. It's possible I'm still worthy of kindness and love under the chin. And understanding, even though this has been happening and I feel really overwhelmed. And the chest. This stress and overwhelm. And go ahead and describe what's been happening for you again. Just take 20 or 30 seconds to describe it. And the side of the body. This stress and overwhelm that I've been feeling in my body. Mm-hmm. This stress and overwhelm that I've been carrying in my body. And tune in and see what sensations are there for you. Are you feeling a tightness in your chest, maybe sensations in your stomach or your shoulders? Go ahead and describe those. Notice if there's any color associated with it, temperature or texture, and just notice that. Yeah. And then the side of the thumb. Yeah. Even though this has been happening, and I have all of these sensations in my body, and I've been feeling so stressed and overwhelmed about this, I'm open to loving and accepting myself just as I am. Yeah. Take a deep breath and then move on to your index finger. No matter how uncomfortable and overwhelming these sensations have been, yeah. No matter how uncomfortable the stress has been, I'm open to the possibility that I'm a good person. And I'm a good nurse. And then the middle finger. And let's just accept that it's uncomfortable and I don't like to feel this way. Yeah. Let's say that one more time under the fourth finger. I don't like to feel this way. It's been hard for me to admit just how affected I've been by this. And the pinky finger. I've been trying to minimize just how overwhelmed and stressed I've really been. Inside of the hand. Denying that it's affecting me. Denying that it's affecting me. Pretending that I'm not struggling with this. Ignoring and burying how I feel. And take a deep breath. Top of the head. I'm choosing to appreciate how exhausting this has been. Yeah. So exhausting to feel buried. the eyebrows. So exhausting to feel buried under all of the stress and overwhelm. What if it's safe for me to acknowledge how I've been feeling? Even just for 2 minutes. And the cheekbones. Yep. I'm open to giving myself loving support and compassion for just how exhausting this has been. Under the nose. For just how exhausting this overwhelm and stress has been. And under the lips, and take a deep breath. I'm open to loving and accepting myself, even if part of me has been putting on a brave face. In the chest. What would happen if I admitted just how overwhelmed and stressed I've really been? On the side of the body. A part of me worries that I might let the people in my life down. And the wrist. I might make more work for others. And the side of the thumb. My patients, my coworkers, my family. It feels like they all need me to be strong right now. And the index finger. I'm open to loving and appreciating myself. Even though I've been so afraid to let people down. Go ahead and take another deep breath. And the middle finger, I have compassion for the part of me that's been putting up this brave front. And under the fourth finger, I'm open to the possibility of forgiving myself for not knowing how to express myself. Yeah, for not knowing how to express this overwhelm. And the top of the fifth finger, top of the pinky. Yeah. I'm open to the possibility that I'm worthy of love and support. And I'm giving myself the compassion I need to help me through this situation. Yeah. And the side of the hand, I'm open to receiving the love and support that I need right now. Yeah. And take a deep breath. On the top of the head. And there's another part of me that's ready to stop holding back. Yeah. A part of me that's ready to tell everyone involved exactly what I think. And the eyebrows. What if just for 2 minutes, I could vent, stomp my feet, and tell someone off? Yeah. Tell them exactly what I think. What if I could do this for just 2 minutes? And then really tune in with yourself and ask yourself, what have you been holding back? What haven't you been saying? Side of the eyes. Go ahead and take a deep breath. On the cheekbones. All of the stress and overwhelm I've been feeling from this situation. What if I could allow myself to express what it is I've been holding back? And under the chin, or sorry, under the lips. I'm open to loving and expressing myself and acknowledging what was left unsaid. In the chest. A part of me has really needed to do this. In the side of the body. And I love and forgive myself for not knowing how to do this. And the wrist. I accept the part of me that needs to express myself in this way. Yeah. And go ahead and take another deep breath. And the thumb. And when you consider the situation again, tune in and ask yourself, what was it that I really needed? Yeah. And the finger. And some suggestions might be to have been seen and to be heard. It's possible I needed to be understood. And the middle finger. It's possible I needed to be respected and appreciated. Tune in and ask yourself, what did you really need then? Go ahead and take another deep breath. And under the fourth finger. It's possible that I'm worthy of receiving exactly what I needed. Even if that's not what actually happened. And the fifth finger. This part of me that's been feeling disrespected or underappreciated, stretched thin, or even taken advantage of. Really tune in and consider, what is it that you've been feeling from this? Yeah. On the top of the head. What I really needed from this situation was to feel, and again, go ahead and tune into that. Is it valued and respected? Safe and supported? To know that what I'm doing is making a difference? Tune in and just see, what is it that you really needed to feel from this situation? From the eyebrows. I'm giving myself permission to acknowledge what I was actually needing from this situation. And take a deep breath. The side of the eyes. I'm giving myself permission to begin to express myself from a safe and grounded place. And cheekbones. I'm allowing myself to process the stress and overwhelm. That's been circulating in my body. Yeah. I'm allowing myself to acknowledge any remaining stress and overwhelm I may be feeling under the nose. Under the chin. I'm allowing myself to clear any remaining sensation and stress and overwhelm from my body. And take a deep breath again. On the chest. I'm allowing myself to clear this from my nervous system. Yeah. I need my energy back from this. On the side of the body. And I'm allowing myself to begin to feel safe in my body again. On the top of the head, on the back of the head, all around. I'm allowed to do this. And I am doing this. I'm open to feeling supported and resourced. Even though I don't know how this can change, or even if it will, I'm open to supporting myself completely. On the cheekbones, I'm ready for a new experience. And I'm starting to feel relaxed and peaceful. I'm allowing myself to feel relaxed and peaceful about this. And take a deep breath. And then go ahead and tap all over your body and tell yourself 3 encouraging and supportive things that you need right now. Yeah. You can just tap all over. Yeah. Go ahead and take another deep breath and just tune in and see where your intensity now is from 0 to 10. And Janelle, when you're ready, you can put your microphone on as well. I'd love to see know what your experience is.
Thank you so much, Tina. That was really great.
Yeah.
Yeah, I feel definitely relaxed. I would say I went from like a 5 to a 3, 2 or 3 maybe, so like in half probably.
Great.
Yeah, for me, I really recognized just appreciating the affirmations and the acknowledgements of how I feel, because I do have that tendency as well to just like get very in my head and like, oh, don't think this, don't feel this, like, and kind of deny how I feel or push it down like we were sharing before. So I think it's really valuable just to acknowledge I feel this and give ourselves that permission to feel how we feel. So, yeah.
Yeah, it's so important. Yeah. Yeah. And then even considering this, I'm not sure how long we tapped for, maybe like 5 or 10 minutes, or no, 5 or 10 minutes, probably maybe closer to 20, but even just to have a drop, that quickly of the stress. And then if you can consider that sometimes the session is usually like an hour, 90 minutes. And so, yeah, you can have really dramatic falls.
Yeah, I noticed there was a lot of repetition. Is that, I think you mentioned before, that's important to repeat the same phrases so they're more ingrained. Yeah. Okay. You could do like a short 10-minute practice, or you could use more repetition and go all the way up to an hour with this. Is that right?
Yeah.
Okay.
Yeah, because oftentimes you can even start to examine, you're looking at like, how are you feeling, and you want to tap on that. What are some thoughts that you're having around that? You tap on that. And then to go even further, it could be, what is this reminding me of? And maybe that look someone gave you, or what someone said, or a feeling that you're having when you really tune into it is actually, when I was 5, my father said this thing, or when I was however old, this thing happened, and it's the same feeling in my body. So we get triggered. whether we recognize it or not. Yeah.
Mm-hmm.
So that's another thing that you could potentially tap through. What is this reminding me of? Who did I see react this way? And what memories come up, and then you spend time with those as well. But again, at work or as a band-aid, 5-10 minutes is perfect. That's all you need to
That's beautiful. Yeah.
Get the cortisol going.
Such a versatile practice, can be short 10-minute anxiety relief or a longer session for deeper trauma release. So yeah,
Absolutely.
wonderful. And could you share a little bit about your practice, what you offer, if anyone's interested in going deeper into EFT, any recommendations you would have for someone who wants to get started or go more into this?
I have a website. It's called Tap to Thrive. So TAPTOTHRIVE.com. Taptothrive.com. You can also find me on Instagram. I'm available on Gmail as well. Tap with a number 2. Tap number 2 Thrive. And I can be contacted that way. I offer 20-minute discovery calls. I also offer 90-minute EFT sessions and packages as well if someone wants to go a little deeper. And then even if someone wants to just get started and to know more about what EFT is, many of the research the research that I was citing is actually shared from a researcher in Australia called Peta Stapleton, P-E-T-A Stapleton. You can find her videos on YouTube. She has a website. She's been researching this for about 15 years. She wrote a book this past year called The Science Behind EFT, which is great and really explains a lot of this. There's also Dawson Church, who is also one of the early researchers in this and offers accredited certification for EFT as well. You can find his information through EFTuniverse.com. My mentor, Sonia Sophia, she offers the World Tapping Circle, where every week she leads a tap, kind of like what I did today, but a full tap. Really brings you in there. And I like to think of it as kind of like Mad Lib, where you enter in your own feelings, your own thoughts, what happened. And but someone's there to like create that container and guide you through it. And she does it beautifully. That's something she offers weekly. And then there's a video library, so you can go in at any time that you need it. It's there. And another suggestion I would have for resources would be the Tapping Solution. They actually are putting out some things for children as well now and getting tapping into schools, which I think is so important, so beautiful. So yeah, they're another great resource.
Oh, that's so wonderful. It's really nice to have resources to guide you, because I was wondering, like, how would I know what to say if I tried to tap by myself? So it's nice to have those frameworks and either in-person guidance or frameworks around you could listen to guide yourself. Solutions, who you mentioned, has an app now. Is that right? They have an app for a phone you can use?
Yeah, no, they have an app. Yeah, they do have an app with some short taps and they're kind of like meditative, mindful taps. I haven't spent too much time on the app itself, but I did see it. Yeah, and I know they're having great reviews for it. Yeah,
that's great. Well, thank you so much for sharing all these resources, and especially for making yourself available for these deeper 90-minute sessions. I can imagine that would be some really deep healing to go into. So thank you so much for the work that you're doing and for sharing it with us and making it so relatable to nurses by sharing your experience as a nurse and the research and science that you've done behind this therapy. And yeah, I hope it becomes even more readily available and recognized, and more nurses can access this. So thank you so much, Tina, for sharing your work and your passion and your personal experience with us today. We really appreciate your time.
Thank you so much for having me. I'm passionate about EFT. I love to talk about it. I love to lead sessions. So yeah, this is really great for me. Thank you so much.
Thank you so much. And thank you everyone who will be watching this video for taking your time out to learn about this practice and to experience it yourself. And please stay in touch with us. We'll be sharing Tina's contact information on the website, and then you can stay in touch for future sessions. We host these every Wednesday with different holistic wellness practitioners. Next week, we'll be having a mindset coach talking about how to create a morning routine to make the most of your day. And at the end of the month, we'll have a guided Qigong class. So thank you so much for joining today, and please stay in touch with Mindful Nurses and join our Wellness Wednesday events every week. Be well, everyone. Thank you.
Thank
Bye.
you.